At this EHA 2018 in Stockholm, Sweden, I was invited to give two talks. The first talk focused on biomarkers in the setting of immuno-oncology drugs across the board of hematologic malignancies. When we use these drugs, we have kind of moved from using more generic toxic agents like malphalan or other types of alkylating cytotoxic drugs to using more targeted monoclonal antibodies or cell therapies, if we include CAR T-cell therapy. And we are increasingly doing more and more clinical trials. The huge difference between the former and the newer compounds is that the newer compounds, they are dependent on having the target there in the patient. The older drugs, they are just general toxins that kill virtually everything. So if you have a drug that is more targeted, that goes after, for example, CD38 or BCMA or any other antigen, if the patient doesn't express it, probably that drug is not going to work. So we clearly need biomarkers to identify, and we use this in clinical trials. It's part of the eligibility criteria. But not only that, if we look for that and the patient has it, and we have many patients that actually do have these markers, when we treat them with these same drugs, there are differences in their outcome. So how could that be? So we have started seeing that, for example, the T-cell repertoires may be different in patients that do respond or they do not respond. So the interaction between the tumor and the host, that's a new dimension. And there are a lot of other examples that actually are different between responders and non-responders. I strongly think that as we move forward, there will be more and more drugs. We already have very many to choose between. They're quite expensive. And to just randomly pick a drug, I don't think is going to be the future. I think we will need a little bit more information before we make treatment decisions. And I think biomarkers that can help and say this drug is very likely to work, I think that's where we're going to land. But there's more work to be done before we are there.